this unit.
Okay.
You might be on the back side. There you go. This is just contact information for the attending physicians and contact information for the nursing station out there. So when you leave, that's kind of what this is why this is at the front. So if you have medical related questions, you can call the doctor. If you have questions sort of in the first hours after leaving, or if you left something behind, you can call the nursing station. Okay, so that's in there for now. The rest of this is kind of about our facility and where to go and what to do, but we're going to keep adding things to this so that as she goes home, then this will kind of
so
be
this is ours.
It's going to be yours. Yeah, but it'd be great to leave it here just so that we can keep adding.
I'll be here.
Okay,
for the
great.
duration.
I'm assuming you're Megan.
I'm Katie.
You're Katie.
So I'm from out of state.
Okay.
And so I have nothing that I can do here. I
Right.
mean, you know, I can't clean my house or do what. So I've kind of taken over sitting with her, and then Megan is my sister. She is POA, full POA, and she is kind of taking care of the stuff outside of here. So she's got kids and all that kind of stuff. So
And she's in Moody, right?
no, Megan is in Bluff Park. Mom's address is in Moody, but we will not be going back there.
Yeah, right. Okay, so let me see. Boy, I was trying to read through living in single level home with husband, but we're thinking that's not the place to go back to from here. I also had a question about her insurance because she's listed, well, let me just say this. When someone comes in over the holidays and they're working on authorization and places are closed and whatever, sometimes they will tell us that somebody is self-pay. I know she's not self-pay. I can see that there's a Medicare and a Blue Cross kind of hanging out in there. So I was just asking questions about that because Medicare, there's a Part A and a Part B. And the Part A is hospitalization and Part B is usually more outpatient driven. So we'll need to clarify which one she has.
Both.
Okay, she should. I mean, age-wise, she should. As long as she's got both, that's fine. And that just means it's a got to get in the system coming over here error. Because the A would help to pay for a skilled nursing facility immediately from here. Skilled nursing is not the same thing as long-term care. So, the goal then would be to try to use her benefit to get her covered, and especially if she has the Blue Cross as a secondary, because Medicare will cover 20 days at 100%.
Okay.
And 80 days at 80%.
Perfect.
So that basically gives, and
That'd
that
be
other
so great.
20% should be covered by the supplemental. So it should give you 100 days.
I'm not totally sure how she is covered on Blue Cross, so we'll have to just wait and see.
Yeah, because sometimes that's just a medication piece, but
Or I don't know if it's just her husband covered under it and she's not at all. I don't know. So she had the cards, but
well,
we'll find
and
out.
that could be part of as we're exploring those options and helping to place that back up. My role on the team is to help with all of that.
Okay.
I'm clinical by background. I'm a physical therapist, but my role here is to kind of help follow the medical pieces, the therapy pieces, and to kind of just help move the admission along and make sure that you all are supported, and especially as we get ready towards whatever comes next.
Okay.
So if next looks like skilled nursing facility, then that's me working with you all to however I need to support you. If you need a list from me on who's kind of in whoever's area, do we go towards Moody? Do we go more towards what you say, Bluff Park? Yeah. Like where do you want me to kind of look? I can provide information, kind of based on Medicare star ratings.
Do you do out of state? Because we're trying to determine right now if she would go with me in Oklahoma.
Yeah.
Because I'm not currently working.
Okay.
And so
in a better position to support her,
Yes.
even if she's
Correct.
in a facility.
Correct.
Yeah. Yeah, because especially if there's cognitive and any kind of memory or anything like that, it really helps to have sort of a stabilizing force.
I don't know how or if you not help but have information about this, but if I were to become her caregiver and be able to modify my home a little bit. I mean, I'm single level, no stairs, and I would just need to modify the shower a little bit, and she could, do that if I had a caregiver allowance to help with,
So there's not really a caregiver allowance through Medicare or through Blue Cross.
Yeah, I didn't think through that, but I didn't know if they were like through her retirement or his stuff or anything like that.
And that would be looking at their benefits and to see, sometimes life insurance policies have a long-term care rider on them, and sometimes life insurance policies will allow you to withdraw the benefit prior to death. And basically it's kind of like borrowing against it. I mean, somebody's going to get it anyway, so why not be her,
The person,
kind of thing.
that's carrying.
So there's some of those pieces. Now, as far as the bathroom goes, I mean, you can use a tub. You would just use a bench so that you sit onto the bench.
I have
and then
open
scoot across.
showers,
Okay.
so like my house is pretty.
Yeah.
Like I could do it with very minimal. Like I would have to remove the doors.
Yes.
And put up a curtain. But I'm pretty set up to be able to do it. I've got a room. I've got a I could. But like, is there any assistance to help rent a hospital bed or anything like that kind of thing?
Those pieces, regardless. So if she doesn't go to a facility and we were aiming towards home, that's part of what we would help with. The therapists that are working with her will actually look at what she's using, what she qualifies for, what she needs, and help to place orders for those moving forward.
Okay.
So that's why it's important to know, are
Where's
we
she
going to
going?
Park or are we going to Oklahoma? Because then they could still work on that and provide, we would just end up
Doing it out there.
and everything would be delivered from there so that if you had the need to be serviced or whatever, they
could do it out there. All right.
So there's that piece. And then even as it comes to, so that's home. And the same thing with like home health care. Like if we transitioned home with either home health therapy or home health nursing, just to take the things that she's learned and done here and make sure you guys are good with what's going on out there.
Yes. Then so that would we could transfer that out
It
to.
depends on the state. Some
It's
states
Oklahoma,
don't
so.
allow, well, and I'm not familiar with that one. I'm familiar with the ones that surround us.
sorry.
That's okay. It's an easy ask. Some will let us write home health orders and they will accept it. Others, you have to have a primary doctor in that state
Okay.
to write, because they want someone who's going to continue to write orders
Yes.
moving forward.
And I would, that's where my brain's going, is that I would
Yes.
transfer all care to
Yes.
Mercy or whatever is best covered
So
out
if
there.
you can get
and-
her established with the primary,
Mhm.
even just an appointment to be seen
Yes.
with somebody out there, which may have to happen. I mean, you can do that now and
Mhm.
just set it for a month from
Yes.
now, and that way you're ready. Sometimes we can say, we're going to write for the next month, and then in the meantime, there's a primary established. They
Okay.
might be fine with that. So
Okay.
that's that piece. If we're looking at facility, can help with those pieces as well. It's
Mhm.
just there's no equipment involved at that point.
Right,
The
'cause the facility has it.
That's right.
Mhm.
So we can do here,
Mhm.
we can look out there.
Okay.
And then is husband going with
Nope.
her?
We don't know. If she's coming with me to Oklahoma, then most likely not. His
Okay.
family's here. He's got a brother and sister that are gonna take care of him.
Okay.
He needs
something,
yeah.
right.
And so we were thinking that if she stays here in Birmingham and we can get them on board with his provider, we are working with a senior living consultant.
Okay.
I can tell you her name. Her name is Melissa. She is from here.
Yeah, yeah.
And so she was gonna
Perfect.
kind of try and bridge the gap because the husband is not
Yeah.
willing to work and with us and stuff like that.
Well,
so
what we could do is try to find a place that has something for both of them, where there's a skilled nurse, because some of them have like,
yes, that's
you know,
what
a
well,
continuous.
we were thinking of assisted living, where
Yeah.
somebody would come in and help him,
Yeah.
and then he would be, watching after her. And so
Does
we
he
even
need
thought about
physical
that.
help or cognitive support?
He just needs physical help. I mean, he's able to do everything. He can get up and shower and brush his teeth. He can do all. I mean, he was
Yeah.
not
Yeah.
trying to do
Yeah.
it, but he, they've got animals and all that, so it was just overwhelming him.
Yeah.
And so if he had help,
Sure.
then he would be better equipped to also, and they could do like sell their home and do assisted living, do an apartment, something like that. So we've thought about that option, but quite honestly, I don't necessarily know about where she goes. And
Yeah.
if that's the case, then and the best thing for her is going to be just focused care. Then
Well,
she is not set apart.
and there's a lot of different options too. Even if there's an interim over where you are, there still could be the option to come back this
with him
direction
if
he's
he-
already
if he-
established somewhere. Or you could do that on the front end, where if you choose a place that has sort of a continuity of care and they have independent assisted
Yeah,
skilled nursing.
that's what we were.
Yeah, that would be the other option too. So lots of options, but you've already got a good handle on just the words and the thinking, and it's good just in the downtime to be having those conversations
Yeah.
when you need to.
And so I've been waiting kind of for this conversation
Yeah.
so that I can kind of move forward with my husband and my sister on the conversation about now, does she come with me to
Mhm.
Oklahoma or does she stay? So we,
Yep.
we will then be talking about that
Yep.
as our next main conversations, especially since this can be like even if we transfer care to a facility in Oklahoma,
Yep.
and if that works, because then I would. But Megan she may want her to stay here, closer to her. It's just stuff that we've got to work out and talk ourselves and kind of figure out what's going to be the best.
It's good too just to think, so you don't become so overwhelmed about just what's the next best thing.
Mm-hmm.
And knowing also that making one decision doesn't sort of remove the option for a different
That's what-
decision next.
That's what I've been scared of, is if I get there and for some reason, I cannot no longer handle it, or, whatever it is, then, we take the next step,
Yeah.
to whatever that may be. So.
Well, and not knowing where they need to land collectively,
Yeah, that's
there
the other
or
part,
there.
yeah.
It's okay. You don't have to know what that looks like in 3 months. You just need to make the next decision for 3 weeks.
Okay, 3 weeks.
And I will say, if you were to go straight home,
Mhm.
you've got 30 days from a hospitalization to be able to transition to a skilled nursing facility.
Okay.
So if you got home and the wheels fell off,
Mhm.
if we were smart about it, we could try to vet a few places prior
Prior
to you
to that.
going, so that you've got a couple
Fallback plan.
Yeah, plan B, just so you're not starting from scratch. 'Cause
Yeah.
sometimes that's the hard part. That's also the other reason to have like home health on board, because the further you get away from here, time wise,
Yes.
the harder it is for us to help with a referral, because
I'd have to have home health.
Yeah, we
Yeah.
no longer have the latest care.
Mhm. If we were to go home to get
Mhm.
back in
Skilled
okay.
nursing. Need is a 3 midnight stay in a hospital in order to be able to go to skilled nursing.
Okay.
And then once you've met the 3 midnight rule, regardless of how long you stay, once you go home, you have 30 days. So
Okay.
even if you got home and you got to 45 days, if there's a hospital admission in there somewhere, as long as it's 3 days,
Then it
you're
just
now
starts,
back
okay.
open to the 30.
It starts the clock, or back
The window to get into a
30.
SNF, yeah.
So there's some flexibility there, so that's nice to know.
Mhm.
I think just the challenge is finding the spot, and then they have openings and
Yes.
fitting the puzzle pieces together
Yep.
from here.
It would be a lot to try to work both areas at once, if you guys can at least nail down.
You mean
where
Oklahoma?
Yeah.
And right now we're just focused on her
Yeah.
because we're used to it. So.
Yeah. Well, really it comes down to then you and your sister.
Yes.
In terms of where we're
Yes,
going,
yep.
as opposed to the other piece.
Yes.
So I would just say that's a great conversation for you guys to have, sooner rather than later, and then, we can work on a plan A and then a backup plan.
Okay.
whatever.
She may already know. Like, if I said, "Hey, can I take her to Oklahoma?" She may be like, "Absolutely not." So.
Well, but have the conversation why, and there might be good reasons too. Medical care is here, so if there's follow-up and that kind of stuff, that's easier to do from here, and it could be that,
But she can't get her to the medical
those,
care or be present necessarily for them.
Yeah.
So whereas I probably could. So anyway, that's just stuff we've got to work out.
thing of being the local one. I'm the local one for my family.
Yeah.
I've got a sister in Georgia and one in Vermont.
We've got a brother in Jupiter, one in Atlanta, a brother in Atlanta, and then she's the only one that's stuck around. I was like, hey, you should have moved away.
Well, and I'm the medical one, so it helps
That's
from that aspect. But it changes the relationship for sure, because
does.
then you're always on the logistics and this and that. Everybody else just gets to call and have good conversations.
She's so tired, fighting with the husband for 2 years now, trying to get her out of there and get her help and care. And
Well, sometimes you need a catastrophic event to kind of tip the apple.
it still didn't. He still didn't. So it wasn't until she called me. She's like, all right. So she's the diplomatic one, and she's trying to honor the wishes, and I don't give a fuck anymore.
Right,
This is, and so she calls me when
And
it's
we're
to that.
done.
Yes, and I mean, so I came in. He called the cops on me. You know, it has been a fight, and we were very sad that this could have been prevented. If he would have known and called, and he noticed this change. But Megan's very tired, but she's the medical one. She has her doctorate in nurse practitioner, and so she's very well versed in what is happening and what is going on, and how this is going to go, and stuff like that.
Everybody's gonna bring skill to the table. So
Yeah, she's got a good one. I'm a project manager, so there's
your
and then the
details.
two boys are the service managers, and so when we need the heavy lifting,
Yes.
like, hey, we need to move some furniture, hey, the brothers come in, and
Well, that's good, because it takes a village. Don't wear anybody down to a nub.
Yeah.
Well, here to be a resource for all of that, so I'm more accessible than I am visible, so
That's fine. If as we are going through this and we have questions, we'll give you a
And
call.
even in there, my email is in there,
Okay.
My cell phone is in there,
Okay.
and it's my work cell, so you're welcome to text it if it helps to get on a text thread.
I'm a
So
text. Yeah, I'm a texter. All right, so yes, thank you.
So if we're on a text thread where
Okay.
one can ask and everybody can see,
Mhm.
I'm happy with that too, because
I
that
love
way you've got a way to refer back to it.
Do you mind if I put our consultant on there too?
Mhm.
Okay.
No, because I'm quite familiar with her. I've worked with assisted living locators, but I've also heard of senior living.
That's her, and her name is, it doesn't say, it's Missy, she goes by Missy. Melissa Cooper, Senior Living Consultant, Senior Placement Services LLC, and she's been very amazing.
Excellent.
We actually, because we had no idea what was going to be like,
Well,
going
right.
from Highlands, like we didn't know if she was coming here or what, so she helped us find a spot at Remember Care,
Yes.
Briar Glen.
Okay.
And so they assessed her at Briar Glen and said, yes, she is a candidate, and they have availability. And so our next move, if we weren't coming here, was we were just going to pay out of pocket
Yeah.
somehow and go do a month there until we could figure out the next
Yeah.
step. So she's been amazing, and she's, like I said, she's also going to try and work the Bob and the husband. So we'll kind of see what comes about that.
Yeah, the hard part with assisted living is that it's not very assisted actually, and it's governed by the state, it's either state or federal now, I can't remember, this is where my brain is today. But it does have requirements that have to be met in order to be present in an assisted living. So like you've got to be able to get.
Yeah, she could do that.
Yeah,
too. If
mobility
you
in
said
that
walk
way.
to that door
Now
with a
you
walker,
might
she
need
can.
help with like bathing and some of those
Yes.
things, but you also have to be able to understand your medications.
Yeah,
That doesn't mean that you're giving them to yourself, but there are a couple of different things where then it makes it difficult because it's sometimes easier, we learned this when we were looking at for my mom, it's sometimes easier to have somebody at an independent living facility.
That's what it is, not assisted. Independent is what she was talking about,
then,
having Bob.
yeah, but then there are a la carte services that you can use for medication assistance.
Yes.
And some of those other pieces.
That's
so
what-
sometimes it's easier to kind of like glue together the right amount of support in an independent living.
It was independent living. It wasn't assisted
Yeah.
living. And so what she was talking about was having them both in independent living, still in
Yeah.
their house doing it.
Yeah.
And then there's some communities she said around her
Yes.
that are really great.
Yes.
And then we could do the cherry picking
Yeah.
on the services, medication, bathing,
Yeah.
all of the
All those
things. So
pieces. And they have transportation.
yes.
All those pieces, and it's not governed the way assisted living
Yeah.
is, and it's cheaper than assisted
Yes,
living.
and
So
that was
then
the other
then
thing,
you
the
can
cheaper-
use that money to then a la carte what you need.
Yes.
Yeah. Good.
That's where we were going. And I actually had a conversation with him 2 days ago. I was like, look, I'm not saying you have to do this, and I'm not saying that this is what we're going to do with mom. I'm not saying anything. I just want you to think about what if there was a place that you could go and you could still be with mama, and there would be people helping you. And at first he was like, no, I'm dying right here in this house. And I was like, okay, that's with you. But I'm not saying, I just want you to think about, I just want to put a little bug in your ear, and I just want you to be thinking about, like, do you want to die in your poop in this house, or do you want to go somewhere that's nice and where people will help you and help mama and all those things? And then I walked out the door. So we'll see.
Well, and he may not respond to what he needs for himself if he'll respond to what she needs.
Yes,
so
he's
somewhere
like,
where she can
mhm.
get the care she needs, because I understand from an independence and a pride standpoint,
Yes.
and that whole XY
Yes.
chromosome thing, that might not be the way to get him there.
But
But
when it's her, then yes. Like if you could still be with mama and they were
She gets
taking
what
care,
she
yeah,
needs.
and somebody's helping you, and then you can take care of mama, and so that's kind of
so like supported environment is a good way to say that. It's a very supportive environment. A lot of the things that are kind of pulling at your time here in the home are not things you'd have to deal with. Trash. Sometimes they do laundry services. I mean, you just have to kind of paint the picture of, because otherwise it just sounds kind of unknowable. And maybe his family taking him to go visit somewhere would help too, so that there's a visual
Yeah.
of this
Will
is not
do.
just a bunch of old people running
Yeah.
around. These people are active and they might run.
And that's what I was like,
circles
Bobby, you have friends and people to talk to, and
breakfast club, biscuits every morning with people, right
Yeah.
now.
like we had Meals on Wheels set up for him, and he turned them away. So things like that, and I don't want him jeopardizing her care, and that's what I worry about.
But
Them staying together.
if you've done a service like that a la carte service, that's why.
But
okay,
if
maybe
he
somebody
turns them
doesn't-
away, is he going to turn them away?
If they're coming, if they've been contracted to give her medications,
Then
then
they're contracted with her, and not him.
yes, and so he can't really turn them away.
Okay.
And
Like-
that would kind of give another layer of, now we've got eyeballs in the house, and if things are not looking good, you've got another way to
Okay.
have input on that.
Okay, good, because that scares me as him. He's just so difficult.
manage it all
He
the
is
time.
so difficult.
Yep.
I can't believe he turned away Meals on Wheels, but But she was malnourished when she came in, malnourished and stroked out for weeks.
Yeah.
With no calling the doctor, sleeping in her pee, in her poop, and that's where Megan called. But she's like, I can't. And this is where I call it because I cannot have my mother sleeping in her urine and her feces.
Mhm.
No, so it's time for you to come do the thing. So
Well, I'm sorry, that's stressful on everybody, but hopefully we've got her in the right place now.
Yes.
And we're gonna keep working on those pieces.
yeah, and you can see I've got her set up in here for however long
I
I
know.
need, and
Great, do it, I love it.